In the next set of slides, we'll cover infertility, but first let's cover the process of a developing pregnancy. So how does a pregnancy occur when it does normally? So let's look first at the ovary. So the ovary is right here in this drawing, and what you can see is the developing follicle as it progresses in this direction. Eventually the egg is released from the follicle and enters the space between the ovary and the fallopian tubes. These are the fimbria. Remember, this is an open space. This is one of the ways that an ectopic pregnancy occurs, where the pregnancy actually is fertilized in a space outside of the uterus, but the egg then is released into this free space. You can see here the corpus luteum, which serves an important function in stimulating hormone production. The egg then migrates into the fallopian tube. You can see multiple sperm here that are attempting to fertilize this particular egg. Once the egg has been penetrated by one single sperm, you can see there, then it forms the two-cell embryo, which then moves through the fallopian tubes, dividing quickly until it is at a stage where it's multicellular and enters the uterus. Then the multicellular embryo then goes on to start to form the placenta. So it attaches to the endometrial wall, and you can see that the interface between the forming zygote and the uterine wall, which becomes the placenta there, is the area from which the nourishment from the mother can get into the developing fetus. So there are a number of different places where problems can arise in this process, and we'll cover a variety of those. Also, going back to the possibility of an ectopic pregnancy, realize that pretty much anywhere along this path, short of coming into the actual uterus, anywhere prior to that, if the developing embryo implants or settles somewhere in the fallopian tube or anywhere high in the uterus, it can create an ectopic pregnancy that obviously goes on to cause a problem for the woman. Another reminder here of the normal physiology. I'm obviously not going to go over this slide in detail, but you need to understand each of these pathways. We're going to cover more in the endocrine portion of the course, but for the purposes of understanding reproduction, you need to understand female reproductive physiology. So be sure you go through this slide carefully and fully understand exactly what's happening in each of the pathways, because as you can see, it's a very complex dance of positive and negative feedback. Positive feedback being stimulation, negative feedback being messages that are sent to turn off stimulation. So you can see that there's a complex interaction between the ovary, the anterior pituitary, the hypothalamus, and the developing the corpus luteum that develops after the egg has been released from the follicle. So quite a complex situation that you need to have a pretty good understanding of. So spend some time with this one. A number of systems can become disordered that can lead to infertility. The endocrine system, the genitourinary system, often with structural abnormalities, and the immune system. There are certain autoimmune diseases that can create problems for fertility, and the body can actually produce anti-sperm antibodies. The thyroid should always be checked in any patient who has infertility. Again, infertility, as a reminder to you, the definition is the inability to get pregnant after a year of trying, and the thyroid can be the source of the problem. A reminder, as we approach the endocrine block of the course, the thyroid can be the source of a variety of different problems. It has such diverse controls over body systems that almost any complaint can emanate from the thyroid. But certainly in a patient with infertility, you need to make sure that the thyroid function is normal. We do this through palpation of the thyroid gland for any abnormalities, and by checking specifically TSH, thyroid stimulating hormones, to make sure that the thyroid is working appropriately. But you can see there's a very big differential diagnosis for female infertility. So this is a list of the various causes broken down into anatomic problems, ovarian failure, infections, and endocrinologic problems. So lots of things to evaluate in a patient with infertility, but if you take a stepwise approach and evaluate the most common ones first, you can generally find the source of the problem. Although it's important to realize that for a number of females who have infertility, no problem is ever identified. So infertility, as I mentioned, is defined as not being able to get pregnant for 1 year. So the required conditions are that you have to have frequent intercourse, unprotected, obviously not using any form of birth control, and attempts to become pregnant have to occur for at least a year. If you're under 35, it's shorter for people over 35 because they're more likely to have an organic cause of their infertility, and that needs to be evaluated. So the practitioners use just 6 months for over 35 because of the higher likelihood of the discovery of some source of the infertility. So the basic evaluation involves an assessment of ovulatory function to make sure that all of the phases of ovulation are occurring normally, and this can be done through the checking of a variety of hormonal levels. An over-the-counter prediction kit is able to detect an LH surge in the urine. So this is something that patients can use. They buy it over the counter, they check their urine regularly, and when they have their LH surge, then that predicts the ovulation. Serial ultrasound, you can actually trace the development of follicles to make sure that that's occurring normally. And then an assessment of tubal function, that is to say, to make sure that the tubal patency is normal, that the sperm and the egg are able to travel through the fallopian tube without being encumbered. This is a representation of a hysterosalpingogram. This is where an instrument is placed into the cervix, and then contrast is injected into the cervix retrograde, so the contrast flows in through the device up into the uterus, and then the expectation is that it will then flow through the entire tubal system as it does normally on the left here, and then you'll see it flow out near the fimbria, and it spills into the peritoneum, and that is normal. What you see here is an obstruction to normal flow, and this could be a source of infertility for this particular patient. Now you have 2 ovaries and 2 fallopian tubes, so the duplication will allow fertility on this woman's right ovary. But the left ovary, when the egg then passes through into the fallopian tube, it is unable to completely pass through this obstruction here that's represented by the blockage of the contrast. The male partner is important to evaluate for infertility as well. So males undergo a semen analysis. There are also combined factors that are sometimes hard to identify or may never be identified. Some couples who are both judged to be able to conceive for some reason are not able to. So there are obviously some factors that we're not aware of that we can't identify. Here's a list of risk factors for infertility. And obviously you would want to evaluate these in any patient that you're seeing complaining of infertility. And here's the explanation for why there are more women in the world than men. You can see there's 2 sperm here who are competing to get to the egg, and the female sperm there is clearly navigating on her own with no problems, and the male sperm is lost there and claiming for sure he's not going to ask for any directions.